Dr. Planty, an optometrist in Texas. Dr. Planty, tell me, glaucoma. Give me the lowdown on it.
Well, glaucoma, there are many different kinds of glaucoma. You can have infantile glaucoma. You can have congenital glaucoma. So even babies can come out in the birth canal with glaucoma.
Wow.
But the more prevalent one is late onset glaucoma, which usually we start looking for in the fourth decade. People in their 40s is where the signs begin to show up, where they may have elevated intraocular pressure, or when we look inside the eye and we're looking at the anatomy of the optic disc begins to turn white and get very, very large. So we're looking for those signs to go ahead and indicate that there's a possibility of glaucoma in that particular person. Glaucoma is also genetically related, so if you have blood relatives that have glaucoma, you are at an increased risk to have glaucoma yourself. The other factor is African Americans have a very high incidence of glaucoma, more so than Caucasians or Latinos, and Latinos would be second, but the Caucasians are the least likely to get it, although you can get it. So African Americans are number one high risk factor, and number two is family history of glaucoma.
Okay, tell me, Dr. Planty, what, besides the technical part of what happens with glaucoma, let's forget that for a minute, because most of us forget it like about 2 minutes after you told us. Now, me sitting in front of my computer or driving down the car or walking or trying to play golf, not that I do, what are the symptoms? When should it be detected? Can it be detected? Can it be prevented? And if it doesn't get prevented, what will it eventually do? Can you go blind from it? If you can get blind from it, can it be prevented? Like dentistry, you can prevent almost everything in dentistry. Is glaucoma something which can possibly be prevented if found early enough?
Yes, it can. Glaucoma is the number one cause of blindness in the world today, and it is a very preventable disease if you catch it early enough. There are no real symptoms for glaucoma. That's why they call it the silent loss of vision. You don't feel anything because there's no pain receptors inside the eye to give you an indication that something is going on. But essentially, nerves begin to die because of an increased pressure on the nerves over a long period of time. That's why it's critical that you find it at the earliest possible moment. The technical things that we look for can only be found by having an annual eye exam. So Helmut, that's another reason for you to get an exam. Even though you don't have any vision problems at distance, you may have the beginning stages of glaucoma and not even really know it.
I see. So does blood pressure have anything to do with glaucoma? Is a high blood pressure an added reason why one should get a glaucoma examination?
Again, there is no direct correlation between high blood pressure and high intraocular pressure inside the eye, but there seems to be just a little bit of a hint that if you do have high blood pressure and glaucoma, it's going to make the glaucoma worse.
Okay. Give me the difference between, there must be some visual symptom coming up eventually when you have glaucoma, yes or no? Or does it come overnight, like a heart attack? You're totally fine and you drop dead.
Well, glaucoma is not an overnight sort of situation. It's not going to happen instantaneously. It's a long, insidious disease that's going to happen over a long period of time. But the number one
so does a heart attack. I mean, it's a misdemeanor to have a heart attack. But my point is, do you see with a heart attack quite often there are apparently no symptoms until you have it, until you are dead or half dead. Is that the same with the glaucoma? Like all of a sudden you go blind, or does it in the end phase take a few months or a few years? And if what symptoms do you have there?
If you don't catch it and take care of it early, basically what you do is you start losing your peripheral vision first, and you eventually get down to where you have tunnel vision. And that's probably the number one symptom is the tunnel vision thing in the late phase of it. You really don't know that it's there because when you're looking straight ahead, your central vision, where you look at people directly, is the last part of the nerves to be destroyed. It's the peripheral nerves that are taken care of first. I see.
So tunnel vision. So what you see clearly, you just start seeing more and more narrow.
Exactly.
Interesting. Well, all right. Do you think there's anything else you need to add on it when it comes to glaucoma? Something something I missed asking you?
No, I think that's it. I think the importance of an annual eye exam is, number one, to check for the eye health part of it. Even if your eyeglass prescription does not change, we're also looking for the signs and symptoms of all these other things that could destroy your vision. May not bother you now, but later on in life, when you don't have it, you're going to miss it tremendously.
Mm-hmm. Okay. And looking for that, let me ask you, and without trying to very objectively, as long as a doctor, an optometrist, isn't a total jerk, which I've working with all kinds of doctors for 20 years now, and I have found very few people who are total jerks. They all really are there to do a great job, and they bend backwards over. They give up profits, which the insurance companies and governments and whatever don't, pay, and they really do what they have to do. But so, as long as somebody doesn't find a total jerk, which is rarely, is any optometrist qualified to find all those things you're talking about here now, especially in glaucoma?
Exactly. We have to pass a state test to have a license in any state that we go to, and that's a competency test to make sure that we're able to go ahead and do all of the things diagnostically that we need to do to help preserve vision in all of our patients. So they're all qualified, but like I said, some of them could be jerks and some of them could be not as good as others.
Okay. But they're basically all qualified, all good and stuff. Does equipment play a role? If an optometrist is having better, more modern equipment, will it be easier or not really?
No, absolutely. I mean, there's so much new diagnostic equipment that's going to help us to go ahead and uncover all of these diseases at the very earliest stages. The technology and the research at this particular point in time for all of these diseases, or actually in any medical field, is off the scale as far as the instrumentation that allows us to go ahead and find these things quicker, faster, sooner to help preserve life and to preserve your vision.
Okay. So basically, a responsible, up-to-date optometrist will have that equipment. Is there any way you can see it? Look, we're walking into his room that you go, oops. Again, like if you walk into a dentist and you see the cables running for his drill, he's outdated.
No, absolutely. You're absolutely right. Now, most optometrists should have really a technician that runs a preliminary exam, and you sit at a table and there's like 4 or 5 instruments that you go through these things to do all the diagnostic stuff on it. So I believe that every optometrist out there should have it. I don't go around to different offices to find that out. Good. I know we have it, and we do it.
Good. Thanks a lot, Dr. Planty.
You're very welcome.